To add an assessment, let's move to the assessment page. Click Assessment below Wound Profile in your navigation menu, or you can click on the alpha created. Both will open the assessment page. The page that opens reflects the wound profile you are working on. Every assessment will allow you to select assessment types used by your organization. Examples are Nurse Full Assessment, which includes photos and measurements. Nurse Partial Assessment. Client, Family Reported. Unregulated Care Provider Reported. Not assessed. You might find that your first assessment defaults to Nurse Full Assessment. However, this depends on the configuration. The first time you complete an assessment for a new wound, it will take a little more time as you'll have many fields to fill out. It goes faster the next time. The assessment allows for 1 2D image and 3 regular images, or a total of 4 images per assessment. A 2D image contains a token, which allows for the wound measurement to be drawn in the image. For a 2D image, the measurement token needs to be present in the image. Select 2D measurement. Click Browse to locate the image you want to have reflected on your assessment. Click Upload after locating the image. The image will now be shown in the thumbnail. Click in the image around the wound to generate the measurement of the wound in the 2D image. Select Save Marking. Then select Save Image if the markings are correct. When you want to add a regular image, select Browse. Select the image you want to have reflected on your assessment. You will see the image selected dropped on the page. Complete all the relevant fields on the page. Fields marked with a red asterisk are required. Select Add My Electronic Signature and Save My Work at the bottom of the page. Adjust the date and time if needed to reflect when care was provided. Your documentation can be viewed by everyone who has access to that patient in Pixlr. After you have added your signature and confirmed the visit time and date, you will get a pop-up reflecting that the data was successfully saved. This pop-up allows you to select to complete another assessment if you have more than one alpha on your wound. You can proceed to treatment or stay on the alpha you're currently on. Select Go to Treatment in the pop-up after you have completed the assessment. Treatment is also found under Assessment in the navigation menu. There are several ways you can choose a product. You can select to search by category or to search by product name. Once you have selected your product, choose the alpha the product is being used on and select Add Product. The product will be added to wound care treatment orders below. You can then adjust the quantity as needed or search and add another product as required. If multiple alphas have been assessed, you can follow these steps for each alpha. Complete all the relevant fields on the page. Fields marked with a red asterisk are required. The dressing change frequency might not be a required field, however, please note, this is needed if you want to run reports like the assessment list report. Select Add My Electronic Signature and Save My Work at the bottom of the page. Adjust the date and time if needed to reflect when care was provided. Your documentation can be viewed by anyone who has access to that patient in Pixlr.